Hello, everyone. Thank you for being here today. My name is Erica Perez. I am a pharmacist for Walgreens, and I do community work here at CU Anschutz Medical Campus. Today, I will be talking about a little sensitive topic for many and for myself. Surely, someone in this room has known of a person that has had an overdose before. Personally, I lost my older brother to an overdose to opioid medications. And today I will be talking about certain tools that we can use as healthcare providers to prevent overdoses in America and just from patients in general misusing or abusing their opioid pain medications. And what specific tools am I talking about? The drug monitoring program, the PDMP, a program that is a shared database that healthcare providers could use to track down opioid prescriptions. And also Narcan is a certain medication that can reverse an overdose. So here we have the national drug overdose death. So you see here in 2017, there were 70,237 deaths just in 2017. And if you see here in the gray as well, it was mostly male and female as well. It just increases every year. In 2007, you see here 36,000 people. So it's a serious problem, and it keeps on growing in America. It's just opioid crisis that we're having now. And the drug monitoring program is a great tool that we can use as healthcare providers to prevent patients from abusing opioid medication. And what am I talking about exactly? Well, my role as a pharmacist, I input the prescriptions I fill, the opioid medications. I take their ID, I input the quantity, I input the drug name, when it was last picked up from my pharmacy, and I mean, it'll show the date when it was last picked up. I mean, it has so much information of the patient, and not just for my pharmacies, but for any other pharmacy. Any other pharmacy can view any information that I have input of that specific patient. So John Doe goes to CVS and fills oxycodone 10 and then decides to take another prescription to Walgreens, oxycodone 10. Well, no, the system will catch it, and then we can deny that medication, or in general just decline and not give the prescription back to the patient. And so doctors in this room, future doctors as well, before prescribing opioid medications, you could also look at their history in the PDMP program and can also see that, mostly for emergency room doctors, you can see where they last filled the opioid medication. So it's just a great tool that we can use as healthcare providers and even law enforcement, even insurance providers. We could all use this system to prevent opioids misuse and abuse. And then also, according to Colorado.gov, in 2014, 2015, pharmacists saw the PDMP, or the drug monitoring program, saw a decline on pharmacists and doctors getting alerts, meaning when a patient's abusing drugs or pharmacy shopping, they get certain alerts. And they have seen a decline because of the drug monitoring program. They have seen a decline on patients trying to refill the opioid medications. Also, Narcan, the other tool. Narcan is a reversal of an overdose, and how exactly it works. You spray one spray of the patient that's having the overdose, and it will basically reverse their overdose. And I know it sounds, too good to be true, but it's true. Most of the overdoses happen at home. And so basically how it works is you see these other receptors that we have in our brains. And so the opioids attach to those receptors. So it slows the patient's breathing. And I mean, it has some, it shows signs of an overdose. It slows a patient's breathing. Blue lips, blue nails are some signs. And so basically what the naloxone does is it attaches to the receptor. So it knocks the receptors out. The opioid knocks them out, which causes the patient to start breathing again. And until the EMTs come for the overdose that's happened. Also, from 1996 to 2014, at least 26,500 lives were saved due to the Narcan from opioid overdose in the United States. So, according to the drugabuse.gov, Narcan has saved 26,500 lives. So, my prime example as a healthcare provider myself, I personally have had an experience at the pharmacy. I had a patient come into the pharmacy with her prescription, her opioid medication. I used the PDMP program, which she was not abusing or misusing the medication at all. But I still offered the Narcan, the drug reversal. And why did I do that? Even though it doesn't show signs of her misusing the medication, it's just a great thing to always offer anybody that has an opioid prescription, because 6 months later, she came into the pharmacy, said that she had to use that Narcan, not on herself, or it was on her son. Her son took her opioid medications, her prescription, and had an overdose, and she was able to administer that at home and saved her son's life. And she came to thank me because I'm the one that saved her son's life. In reality, is just offering the Narcan, promoting this certain drug, doing what we have to do as healthcare providers to save a patient from the opioid crisis. And as healthcare providers, I want everyone in this room, once you graduate, once you become a doctor or a pharmacist, please, anytime you have a prescription, an opioid prescription, prescribe Narcan with it. And take the time to use a drug monitoring program. It doesn't take that long to see in the history of the patient. See what medications they've been on, or what pain medications they've been on. And now that you know the severity of the opioid crisis here in America, hopefully you take the steps to prevent patients from misusing and abusing medications and helping our community be a better place. Thank you.